Well, all countries in Europe are facing really very similar challenges. First of all, the global economic downturn, and hence nearly all countries struggling to find enough resource to fund their healthcare systems. And secondly, all countries face challenges in terms of more people living longer, and indeed living longer with chronic disease. So they've got both financial pressures to deal with, but also those related to health need. And primary care, we know from research over many years across many countries, primary care is critical to helping a country have good health outcomes, but at a reasonable cost. Countries are finding that it's unsustainable to run the hospital system that they've got at the moment. They just physically can't afford the extent of hospital capacity that they've got, or certainly can't afford it to keep expanding. So that's leading them to think about different ways of providing care and to question whether things that were provided on an inpatient basis could now be provided on a day case basis, or that procedures that happened in a hospital could now happen in a community setting or even in a patient's own home. So all of that's going on, but at the same time there's a lot of technological change that's enabling a new focus really on primary care, and that's things like the use of social media and the internet, different ways patients can get information about their health, they can access advice from a family doctor or a nurse, and also new technologies in terms of different drug treatments, developments such as polypharmacy, all sorts of things happening that will mean there are simpler and more straightforward ways of managing patients' care in the primary care setting. I think critically it needs to have the ability to provide really good access for all people, all patients, to advice and diagnosis and support, but also the ability to make sure that they get the specialist support and advice they need to manage conditions that for whatever reason can't be dealt with purely in primary care and general practice. And getting that balance between that general community focused care and the more specialist and quick access to good specialist care, whether that's in a hospital, certainly from a specialist consultant, that's critical, and that's taking up a lot of the discussion here at the European Health Summit. It's been a big topic of conversation, that balance between the specialist and the generalist and what happens in hospital or in primary care. What we need there is we do need teams of specialists, of family doctors, of nurses, of physiotherapists and others working together to actually design and sort out how care coordination can happen in a particular context, because it will be different in different countries depending on how the health system's already organised, but also even within a country it can be different in a very rural setting from how it would be in a big city where there are lots of other providers around. So I think there's a need for that kind of local thinking, but alongside that and to support that, I think each country does need some quite clear standards that it can share with the public to say, if you have dementia or if you are living with diabetes, this is what you should expect in terms of the sort of services you can access, and this is who will coordinate them for you and will give you information. Because I think for patients and the public, the thing that frustrates them most is when that coordination isn't there for them and their families. I think primary care needs to operate at greater scale. We talk a lot about integrated care, particularly for people with complex conditions or older people living with dementia. But what we often don't do is think about how general practice and primary care need to change to scale up, to be available 24 hours a day, so that we really can start to avoid the unnecessary admissions to hospital that take place. So yes, so primary care has to find ways of scaling up, but it has to become bolder about setting standards and tackling variation where practices or organisations aren't meeting those standards. Because I think some of the scrutiny and management attention that's been given more to the hospital sector in the past now needs to be applied to the primary care sector, which in turn will help primary care find its sort of rightful central place within our health systems.